We did this project in partnership with the Empowerment Council, as well as a number of other organizations, many of whom work directly with people living with mental health or substance use issues.
So the Empowerment Council is an organization run by and for people with mental health and addiction issues. So what we do is we try and address matters that affect people who've been in the mental health or addiction system in a way that will lead people to get their self-identified needs met. And a big need people have had is to get adequate primary care, which is difficult to come by when you have a mental health or addiction history.
In this project, we conducted interviews with 85 service users, people who themselves have experienced mental health or substance use issues, as well as 17 service providers who work directly with this population.
And actually sitting across the table from folks who have had these lived experiences and the ways that we can't generalize what it is to walk into a doctor's office as someone with a substance use or mental health history or experience.
Something that would at least start a conversation with the service providers about the barriers that are in their workplace for the people that they're trying to serve, but also a conversation about what they could do.
Our research team used the data from these interviews to identify barriers and facilitators to primary care access, and we found that they fit into these three broad categories. We found that people talked about client-level barriers to primary care access, things like poverty, lack of transportation, as well as mental health experiences themselves, like anxiety and psychosis, that make it hard to access appointments and sit in crowded waiting rooms, for example. We also heard about service provider-level barriers. These are some of the issues people face when they encounter service providers who either are not knowledgeable about mental health and substance use, or who don't see that as being a part of their practice. So our participants described a lot of experiences of discrimination in primary health care settings. Finally, our participants talked about a lot of barriers at the health systems level, particularly about the way the primary care system is structured in Ontario in ways that makes it difficult for patients who have complex needs, such as those who are living with a mental health or substance use issue, to get their needs met in a comprehensive way. And so the point of this study was try to understand what's happening within the system that's preventing this from happening. The skits that you are going to see exemplify some of those experiences. We used our interview data to identify some typical experiences or stories that we heard from people about the kinds of experiences they had when they were trying to access primary health care. You will see members of our research team acting out the roles of healthcare providers and service users in ways that our participants described as being troublesome or difficult for them. And we're asking you to think about what's happening in the scenario, what kinds of barriers people are facing in these situations, and how things could be different for them in order for them to have a better experience with the primary health care system.